What are high blood pressure and prehypertension? Blood pressure is the force of blood against the walls of arteries. Blood pressure rises and falls throughout the day. When blood pressure stays elevated over time, it's called high blood pressure. The medical term for high blood pressure is hypertension. High blood pressure is dangerous because it makes the heart work too hard and contributes to atherosclerosis, hardening of the arteries. It increases the risk of heart disease, see box 1, and stroke, which are the first and third leading causes of death among Americans. High blood pressure also can result in other conditions, such as congestive heart failure, kidney disease, and blindness. Risk factors for heart disease. Risk factors are conditions or behaviors that increase your chances of developing the disease. When you have more than one risk factor for heart disease, your risk of developing heart disease greatly multiplies. So if you have high blood pressure, you need to take action. Fortunately, you can control most heart disease risk factors. Risk factors you can control: high blood pressure, abnormal cholesterol, tobacco use, diabetes, overweight, physical inactivity. Risk factors beyond your control: age 55 or older for men, 65 or older for women. Family history of early heart disease: having a father or brother diagnosed with heart disease before age 55, or having the mother or sister diagnosed before age 65. The blood pressure level of 140/90 mmHg or higher is considered high. About 2/3 of people over age 65 have high blood pressure. If your blood pressure is between 120/80 mmHg and 139/89 mmHg, then you have prehypertension. This means that you don't have high blood pressure now but are likely to develop it in the future unless you adopt the healthy lifestyle changes described in this brochure. People who do not have high blood pressure at age 55 face a 90% chance of developing it during their lifetimes. So high blood pressure is a condition that most people will have at some point in their lives. Both numbers in the blood pressure test are important, but for people who are age 50 or older, systolic pressure gives the most accurate diagnosis of high blood pressure. Systolic pressure is the top number in a blood pressure reading. It is high if it is 140 mmHg or above.